wanted to lay down and go to sleep, and I hoped I wouldn't wake up.
It was scary to hear her struggling to breathe.
I knew if something wasn't done, something really bad was going to happen to her.
She said it almost looked like she's had a stroke.
It's almost gut-wrenching to have her go through this all the time.
I was afraid, is this going to happen every night?
Next, two medical mysteries that defied the experts. For months, Dara Handel lives with agonizing chest pains, extreme fatigue, and a debilitating cough. Worst of all, every breath feels like it could be her last. Her doctors aren't sure what is causing her severe symptoms, and Dara begins to fear that whatever she has may have deadly consequences.
I had been fighting something for a long time, and I'd been fighting a losing battle.
Then, a seemingly healthy 6-year-old Erin Walsh wakes up her parents night after night with a very bizarre and frightening symptom. And she has absolutely no memory of any of it. Every specialist they see is baffled, and none of them have any answers.
I'm supposed to take care of her and make sure stuff like this doesn't happen. And there was nothing that I could do to prevent it.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the summer of 2001, 34-year-old Dara Handel was a healthy and very busy stay-at-home mom in Orange County, California.
We would wake up in the morning and hit the ground running, and it just seemed like we never had any downtime.
Dara was very active in the school projects. She was room mom all throughout our kids' schooling.
It seemed as if the Handels were living a typical suburban life, until one day, when Dara receives a distressing phone call from her sister in Idaho.
Her sister's house, unfortunately, burned down, and Dara flew out to help her sift through the ashes.
Dara spends a rough week with her sister, going through the debris, and then returns home. About 3 weeks later, she comes down with a cold, but doesn't give it too much thought.
I just felt a little run down, and I thought maybe I had breathed in some smoke or some insulation.
She began to have these flu-like symptoms, wheezing, coughing, headaches.
We talked to each other about every day, and I could hear in her voice that she was having a problem.
After a few more days with no let-up, Dara checks in with her family doctor. He assures her that it's nothing serious, probably just a bad cold, and suggests that she take an over-the-counter medication to settle her cough. But over the next few days, it's clear that the medication is not helping. In fact, Dara's symptoms are intensifying.
All my joints were starting to ache all the time. I was beginning to have headaches that were almost debilitating. I had a cough that was really deep and really hard. So I called my doctor back and I said, the medication isn't helping me because I'm actually feeling a little worse.
Dara's doctor tells her she probably has bronchitis and prescribes an antibiotic, but it seems to have no effect.
I would cough so much that I'd wake my husband up, and I was worried about him not getting enough rest to go to work. So I decided that I would sleep on the couch downstairs.
For days, Dara rarely leaves the couch and has absolutely no energy to do anything.
I would go to work, she'd be on the couch. I'd come home, she'd be on the couch, watching TV or sleeping. And that was pretty much her life at that time.
Then, 2 weeks after Dara first began feeling sick, things take a turn for the worse. She is awakened first thing in the morning by severe chest pains.
It was about 6:10 or 6:20. I woke up because I was kind of having a hard time getting enough air. My chest was tight. I was having a stabbing pain, like you wanted to just grab your chest, grip it. It hurt so bad.
Dara decides to turn on the television in the hopes that it might lull her back to sleep. But she's absolutely shocked and horrified by the images coming across the screen.
When I turned on the TV and saw what was going on, I wasn't falling back asleep. I was stunned.
It is September 11th, 2001. Dara watches the tragic events in New York City, all the while experiencing a stabbing pain in her chest.
Finally, my husband came downstairs and I said, I think I'm having a heart attack. And he said, what? This is crazy. And he said, let's just call the doctor and see what he says. When I told the doctor I thought I was maybe having a heart attack, he said, you're too young for that. You're only 34. It's probably anxiety, so I don't think you need to go to the hospital. Come to my office and we'll do an EKG.
As soon as Dara arrives at her doctor's office, they hook her up to an EKG, and she and Lex wait anxiously for the results. A few minutes later, they breathe a big sigh of relief when they find out that her heart is fine. The doctor attributes Dara's pain to an anxiety attack triggered by the tragic events of the day. But 2 weeks later, the symptoms linger on, and Dara begins to feel worse than she's ever felt.
When I would call her of a morning and ask her how she felt today, she would just tell me, I'm just so tired, Mom. I don't want to get up and move.
My chest hurt so bad. I had a rattle and a deep whirling feeling inside my chest. And I felt like I was slowly being suffocated.
It got to the point where I could actually hear her breathing and wheezing. It sounded like blowing bubbles in a glass through a straw. It was very disturbing.
Dara checks in with her doctor again, but he delivers the same diagnosis, bronchitis, and gives her yet another antibiotic to try. But like all of the others, it does nothing to help her symptoms, and Dara hits an all-time low.
At that point, my quality of life was going down so bad. I couldn't be a wife, couldn't be a mom. So my poor husband was trying to take care of 3 little kids and a sick wife and go to work and maintain a household. The only thing I looked forward to was laying there on the couch. I just felt like I had become useless.
You could just tell she was miserable, and we did everything we could to help her.
At this point, after 2 months of being on and off various antibiotics with no positive results, Dara is beginning to worry that she may have a serious lung condition.
I went to the doctor and I told him that I thought I had pneumonia. And he said, well, I don't think so, but we'll do a chest x-ray. And when it came back, he called me a couple days later and he said, wow, you were right. You have pneumonia. It's a pretty good sized pneumonia too. I thought, is this ever gonna end?
For 3 months, 34-year-old Dara Handel has suffered from a variety of debilitating symptoms: shortness of breath, joint and chest pains, extreme fatigue, and a severe cough. She's been on and off various antibiotics with no relief, and finally her doctor has diagnosed her with pneumonia.
My body was tired. I had been fighting something for a long time, and I'd been fighting a losing battle.
Dara's doctor reassures her that a new antibiotic will get rid of her symptoms for good, so she begins taking another antibiotic. But yet again, Dara feels no relief and begins to lose faith that she'll ever get better.
I was feeling horrible. My body hurt so bad. I just wanted to lay down and go to sleep. And I, at that point, hoped I wouldn't wake up.
I knew if something wasn't done, something really bad was going to happen to her.
Worried for her daughter's life, Virginia insists that Dara get a second opinion.
My mom said, you're going to another doctor, and you're going now.
At her mother's behest, Dara calls her insurance company and demands to see a lung specialist.
I said, if you don't send me to a pulmonologist, I'm gonna die.
The next day, she meets with Dr. Thomas Vauvin, a pulmonologist, who immediately realizes that there is something seriously wrong with Dara.
She just looked sick. She was short of breath and she was wheezing. It was concerning because it was localized wheezing, so that means there's something in the airway.
Dr. Vauvin performs a thorough examination, and Dara walks him through everything she's experienced in the last 3 months, including the fact that she first started feeling sick right after being around smoldering debris from her sister's house fire.
When he listened to my lungs, he said, "You have some of the worst lungs I've ever heard."
I just couldn't put it all together. I thought it was some kind of inhalation injury, a bad pneumonia, or some other inflammatory process. That's the reason why I thought it was necessary to hospitalize her.
2 hours later, she and Lex arrive at the hospital. Dara is admitted and set up in a room and meets Dr. Vauvin's colleague, Dr. Ali Tabatabai, an internist. He too is astonished as he examines her.
I was really amazed at the chorus of sounds that I heard on her lungs when I examined her. She had everything that you can think of, crackles, wheezes, and she had diminished breath sounds.
Immediately, Dr. Tabatabai orders a battery of tests, including a CAT scan of Dara's chest.
As scared as I was, I felt like, at last, they were going to find out what was wrong with me.
Dara is also relieved to hear that they'll be able to give her something to ease the painful wheezing.
The respiratory therapist came in and put a mask on and put medication into it. You breathe in real deep, and the medication helps your lungs to expand so that you can breathe better.
Dara gratefully takes the medication and waits for relief. But a few minutes later, something goes very wrong.
I was laying there trying to rest, and about 15 minutes later, my heart started racing. It was hurting, and I said to the nurse, "I think I might be having a heart attack."
Dara is rushed to the cardiac unit and immediately hooked up to an EKG to monitor her heart. After a tense 20 minutes, the doctors rule out a heart attack, but they're baffled and unable to pinpoint the underlying cause of Dara's chest pains.
I was concerned for her life, I really was. So I caught the first plane out and came down.
I was laying there, feeling about as miserable as you could possibly feel, when all you really want is your mommy. And she just walked in.
She just looked so bad and couldn't hardly talk to me.
When the results from the chest CAT scan come back, the doctors are finally able to rule out any inhalation injury that Dara may have suffered while cleaning up after her sister's house fire. It appears now that the timing of this incident and the onset of her symptoms is nothing more than a coincidence.
It wasn't in an area where inhalation could have gone to, because typically if you inhale something, it goes into upper lobe, but she had mainly lower lobe disease.
But her doctors are alarmed. Her right lung shows evidence of infiltrates or spots of haziness that can signify infection, inflammation, or something far more serious, lung cancer.
It was devastating. You don't ever want to hear your wife has lung cancer.
That was probably one of the most terrifying things I've ever heard. The thought of lung cancer scared me half to death because I thought maybe that is what's wrong with me.
"34-year-old Dara Handel is in the hospital suffering from a mysterious lung condition. Her doctors are not sure what's causing her to be so sick and think she may have an infection, inflammation, or even worse, lung cancer."
The CAT scan was abnormal. It showed many spots that didn't make sense to me, and I couldn't tell if it was cancer or not.
I knew there was something serious going on, and we just wanted to know what it was.
Dara's doctors decide that the only way to figure out what's going on is to examine the tissue inside of her lungs. So they order a bronchoscopy, an exploratory procedure in which a tube is inserted through the nose, into the airway, and down into the lungs, where small tissue samples can be removed and analyzed.
The pulmonologist can look into the lungs and see if there's any mass, any growth, or any evidence of inflammation or infection.
Dara knows she needs the procedure right away, but it is the day before Christmas, and she can't bear to be in the hospital.
I said, well, we can just bring all the presents and come up to the hospital and spend Christmas Eve here. And she said no, she just had a fit.
Somewhere in the back of my mind, I knew I wouldn't be around if they couldn't take care of what was wrong with me. This would have been my last Christmas. I just wanted to be there with my kids, with my husband, with my mom. So just let me go home just for Christmas Day, please.
Dr. Tabatabai agrees to discharge Dara, but only if she promises to return 2 days later for the bronchoscopy. She agrees, and a few hours later goes home to her family.
We had the fireplace going, we had hot chocolate. It was kind of like the all-American Christmas. And it was going to be the best Christmas ever.
The holiday is a welcome distraction, but on December 27th, Lex takes Dara back to the hospital to have the bronchoscopy.
I was scared to death that when they put a tube down my throat, I was not going to be able to breathe or that I was going to choke.
During the procedure, Dara is sedated but conscious. It lasts about 20 minutes, after which the tissue samples are immediately sent to the lab to be analyzed. Meanwhile, Dara, still wheezing, stays in the hospital to recuperate and fears the worst. A week later, she receives some news.
The bronchoscopy didn't show any evidence of cancer or malignancy, so we could more or less put the cancer issue to rest.
Dara and her family breathe a huge sigh of relief, but they know that Dara is nowhere near out of the woods.
I was ecstatic to hear that she didn't have lung cancer, but we still didn't know what she did have, so that was still scary.
Dara stays in the hospital for a few more days while the lab continues to analyze the lung tissue samples. The family is praying the team will find some clue as to what's causing Dara's puzzling symptoms. When the reports finally come back, Dara and her family are completely stunned by what they hear.
She had multiple organisms growing out of those tissue samples. We saw she had growth of several different molds and fungi. We saw Cladosporium, Aspergillus, Stachybotrys, and Candida. We knew at that point she had hypersensitivity pneumonitis.
Hypersensitivity pneumonitis is a pulmonary condition that occurs when your lungs become severely inflamed as a result of inhaling foreign substances, such as dust, mold, and fungus. The disorder typically affects people who work or live in areas that are exposed to high levels of these organisms, like farms and industrial plants, and it is unknown exactly how many people suffer from this condition.
Even though I felt like they finally had found out what was wrong with me, there was a problem. I didn't know how I had even come in contact with this.
Because these molds and fungi are not typically found in a person's lungs, Dara's doctors are perplexed as to where she may have been exposed to them.
It is typically an occupational disease. Patients who have been exposed to moldy hay, they can get farmer's lung, or individuals who have been exposed to bird excrements can get bird fancier's lung. We didn't have a good answer about the source of the fungal infection. There was no real indication or clue.
Despite the lingering mystery, Dara's doctors know time is of the essence. Their first priority is to focus on wiping out the toxic levels of mold and fungi. They prescribe high doses of antibiotics and an antifungal medication, then send Dara home to recuperate.
I would start to do really good when I left the hospital, and I would think, oh, at long last, I'm gonna be better.
But it's extraordinary. Although she initially feels better, a few days after being home, her symptoms return with a vengeance.
It was hard to tell just what each day was going to bring. You just kept wondering, would it get better?
34-year-old Dara Handel suffers from hypersensitivity pneumonitis, a debilitating pulmonary condition caused by various types of mold and fungi growing in the lungs. She begins treatment in hopes of wiping out the combination of organisms making her so sick. But over the next few weeks, she doesn't get any better, and her doctors are puzzled.
We were all scratching our heads trying to figure out which direction to go. She would show an initial improvement, but sooner or later she would have a relapse.
It just seemed like every week I was having to go back to the hospital.
After 4 months with no significant improvement, Dara's doctors make a peculiar suggestion.
Since she didn't have any known exposures outside of her home or in a professional way, we concluded that Dara must have her home checked to see if there's any evidence of these organisms.
Despite their skepticism, the Handels bring in a mold specialist to test their house. And when the results come back, everyone is shocked.
They found that we had really high numbers of Stachybotrys. That's what most people call the toxic black mold. We also had Cladosporidium, we had Aspergillus. My lungs actually ended up matching our house samples, like exactly.
The mold, it went up as far as you could see, and it was thick, looked like black hair. It was nasty looking.
We didn't realize, but within a common wall, our neighbors had had a water break. There was a clean water line to their shower, and it had covered the back of our wall with water, and that allowed the Stachybotrys to grow, along with the other molds.
And the area of the wall with the most mold covering it? The family room, on the other side of the couch where Dara has parked herself the entire time she was sick.
If we would have never found out where the source of the mold was, there would have been no way to stop the exposure. The medications that they gave me did all that they could do. All of a sudden, it made perfect sense.
The organisms in her home are literally threatening her life, and her doctors tell her she must never set foot in it again.
And I said, what do you mean if I just leave my house? And they said, if you want to live, you'll leave.
Dara and Lex take the warnings seriously. A few days later, she is released from the hospital, but they don't go home. Instead, they purchase a motorhome for the family to live in. About 3 weeks later, Dara's condition begins to improve significantly.
As soon as we left the house and left everything behind, I didn't get sick anymore. I started feeling better, but I could tell that we were finally on a road to recovery.
Dara knows that discovering the mold and moving out may have saved her life.
If somebody is exposed to an allergen that's causing hypersensitivity pneumonitis without being removed from the environment, chronic damage takes place in the lung, which causes fibrosis and thickening of the lung tissue. If this persisted, her illness could have been fatal.
With such high levels of mold and fungi growing inside their home, it's puzzling to the Handels why no one else in the family got sick.
Some individuals are just inherently more sensitive to various different agents, and she had a lot of exposure.
Some patients, just because of their genetics, have an inability to fight off fungus.
While it is a complicated diagnosis, Dara still wonders why her first doctor didn't take her case to the next level.
One of the hardest things was in the beginning. I think the doctor thought I was crazy. He didn't believe me. I think he thought I was a hypochondriac.
Her diagnosis was hard at first because she presented with what seemed to be a garden variety pneumonia. And at first, nobody really expected her to have fungal growth in her lungs because of lack of past history of exposure.
Today, 5 years after being diagnosed, Dara's still adjusting to the long-term effects of severe lung problems.
Because of the level of exposure, her lungs have been changed permanently, but it's not to the point where she would actually require oxygen. But she does require to use inhalers and medications occasionally to help her with her symptoms.
She'll never be 100%, and she still has hypersensitivity pneumonitis, which she'll have for the rest of her life.
You have to move forward. And that's what we had to do. At least we knew what had made me sick. I was going to be alive. I was going to have another Christmas with my kids. I was going to make it.
While Dara Handel couldn't ignore the symptoms that left her nearly incapacitated, little Erin Walsh had no idea that she was suffering from a potentially fatal disorder until it was almost too late. In 2004, Erin Walsh was a playful and energetic kindergartner who lived with her parents and grandmother in New Jersey. Other than coming down with the usual childhood coughs and colds, she was a healthy and very normal kid.
She was a very outgoing child, has always been outgoing. She was in Brownies and loved being in the Girl Scouts.
She was, at the time, 5 going on 15, it seems.
But one November evening, around 9 o'clock, Erin's mom, Kim, tucks her daughter into bed like she usually does. Then, about an hour later, something very bizarre happens.
I was in the next room over watching television, and I heard an odd noise as if Erin was choking on a piece of food. So I ran in, and I saw her sitting up with her eyes closed, and her mouth was wide open, and then all of a sudden she vomited. And I cleaned her up and changed her, and she went right back to sleep.
The next morning, Kim asks Erin how she's feeling, but Erin seems to be totally fine and has no memory of throwing up the night before.
I took her temperature, and she didn't have any normal signs of a virus. And she looked as if, she was back to normal.
Kim trusts her instincts and decides Erin is well enough to go to school.
She went through school fine, came home from school fine, was talkative, active, was hungry for supper, then went to bed approximately the same time as she usually did. And out of the blue, she got sick to her stomach again.
It was almost like deja vu. I heard her make the gagging, choking sound again. I ran in, and then she vomited.
She would be gagging, like as if she had something stuck in her throat. And I went right to her, and I said, "Are you all right?" And she never answered me.
Linda has never seen Erin like this before. She appears to be in a deep sleep and completely unaffected by what's just happened. Linda and Kim quickly clean Erin up and tuck her back into bed. An hour later, to their surprise, Erin vomits a second time. Kim assumes Erin has simply caught a stomach bug from another kid at school, but decides to take her to the pediatrician the next morning to make sure.
The doctor noticed that she had a postnasal drip and thought that possibly she had a sensitive gag reflex, and told us that we should put her on a over-the-counter medicine, some kind of decongestant.
Postnasal drip is a common condition where a person has too much mucus stuck in the back of their nose and throat. This excess mucus may be causing Erin to gag and spit up.
I figured once the postnasal drip had ended, then she would stop vomiting.
Kim follows the doctor's orders, giving Erin the decongestant for the next few days, but it doesn't seem to be helping at all. In fact, Erin's nightly vomiting episodes haven't let up a bit.
A week to a week and a half later, it hadn't worked itself out yet. I guess it started to become more concerning when, it was happening on a nightly basis.
Despite throwing up twice a night for 10 days, Erin still has no recollection of these episodes and does not seem to suffer from any other symptoms. No weight loss, sore throat, or extreme fatigue.
I just can't remember it because I'm asleep when it happens. I'm asleep, I sit up, I throw up, I go back to sleep and lie down.
Disturbed by this unusual behavior, Kim takes Erin back to the pediatrician for a checkup, but the doctor simply repeats his diagnosis. Erin just has a bad case of postnasal drip. After yet another week passes by with no let-up, Kim begins to worry that Erin could have something more serious.
I just didn't believe that it could be the postnasal drip anymore because she wasn't blowing her nose, she wasn't coughing up phlegm.
Desperate, Kim takes Erin back to the pediatrician's office for a third time. A different doctor in the practice examines her and then suggests that the problem may be acid reflux, a common disorder that occurs when liquid in the stomach is regurgitated back up into the esophagus. Erin is immediately referred to a gastroenterologist who performs an upper GI test.
They made Erin drink this white liquid to coat the lining of her esophagus and stomach, and then she had to lay down on a table, and there was a machine that ran over her chest. It showed whether the liquid was coming back up or if it was just going straight through.
It quickly becomes clear in the test results that the liquid is not coming back up. The next morning, the doctor rules out acid reflux and any other gastrointestinal abnormalities. Kim is relieved nothing serious appears to be wrong, but also disappointed, because it seems that no one has a clue what's going on with her daughter.
I was kind of getting frustrated, and so I really was doing a lot of research on the internet, and a lot of it led back to the acid reflux. But I knew we had already gone down that path, so I felt like I was at a dead end.
For the past month, 6-year-old Erin Walsh has vomited 2 times a night almost every day of the week. Her family is extremely concerned by this bizarre behavior.
1 minute she's asleep, and then all of a sudden you hear her making a gagging, choking noise, and then she would vomit right after and just lay right back down again after she was done.
What's even stranger is that Erin appears to be in perfect health and is completely fine all day. And despite a multitude of trips to the doctor, no one can find anything wrong. The family quickly establishes a system for dealing with her nightly vomiting episodes.
We didn't break the routine of reading a story to her. That remained the same. What did change was how we prepared her and the room.
I would always prop up the pillows. I made sure that I always had a change of sheets or a change of towels or pajamas on hand, so that way if I did need to change her, it was all ready to go.
The biggest concern was that she would fall back to sleep and choke.
Week after week, Erin continues to throw up every night. The episodes, which last less than a few minutes, take a toll on Erin's family, but don't seem to be affecting Erin physically or emotionally.
During the day, she was back to Erin. She was herself, eating breakfast, going to school, and as if it had never happened the night before.
Erin's family is baffled by these bizarre nightly events that have been going on now for 6 weeks, and they're not sure where else to turn.
You're going from this professional to that professional. You're doing what you're supposed to be doing, and nothing's happening. You're not getting any answers. No one's ever heard of this behavior.
Frustrated with having no answers from the doctors, Kim takes matters into her own hands. She begins to suspect that maybe Erin is eating something that is causing her to vomit, so she adjusts Erin's diet to see if that does any good.
During the day, I tried to make sure that she got her proteins and carbs and vegetables, but then by 4 o'clock, she had to eat this restricted diet. I made her eat foods that would break down easily in her system, like mashed potatoes or sweet potatoes, just in hopes that whatever she ate wouldn't come back up again.
Kim's experiment with Erin's diet has very little effect, but she continues to search for other clues.
I thought to myself, it's only happening at night. Why is it only happening at night? Is she allergic to something in the room?
Thinking that this is a new direction, we went through the room, stripping the blankets off the bed, the mattress pad, vacuumed everything, washed the drapes, washed the windows, washed the blinds. Tried to, in some ways, make the room sterile.
When Kim finally takes Erin to see an allergist, she is told that it's highly unlikely that allergies are the problem. However, the doctor does suggest something new, an anti-vomiting medicine, which Kim gives to Erin that evening. It works, and for the first time in weeks, Erin sleeps through the night.
It was a relief because I thought possibly the medicine was working, and I was so happy that finally she was having a vomit-free night.
The next day, Kim is the most positive she's been for months and thinks perhaps the episodes have finally passed. When Erin takes the medicine again that evening, Kim is hopeful she will sleep through the night. But an hour after she goes to bed, Kim's hopes are dashed.
It didn't work, and once again, we were back to square one.
When Kim takes Erin back to the allergist to check in, he offers no further advice. Kim and her family are beginning to feel like they're running out of options.
After 2 months, there's an escalated level of frustration. It's gut-wrenching to have her go through this all the time.
But one evening, when they thought it couldn't get any worse, it does.
She had her first episode an hour after she went to bed, which was normal. She had her second episode an hour to an hour and a half after she went to bed, which I expected too. And then about 2 hours later, she had her third episode, which was unexpected. And then an hour after that, she had her fourth episode. And I was afraid, is this gonna happen every night?
Amazingly, the next morning, Erin is tired, but otherwise seems to be just fine. Kim, however, is frightened by this latest escalation and keeps Erin home from school to rest.
I was worried about how long-term, how it was gonna affect her body. It was just a horrible feeling to watch her every single night getting sick, and there was nothing that I could do to prevent it. And I was angry also at myself because I felt I'm supposed to protect her and I'm supposed to take care of her and make sure stuff like this doesn't happen.
Then, just a few days later, Kim witnesses the most terrifying episode yet.
Kim came out of the bedroom and her face was ashen white. And she had such difficulty getting the words out. She was fighting back the tears and the fear. And she says, "Oh, Mom, she just had an episode." And her face sagged, and she was slurring her words. And she said it almost looked like she's had a stroke.
6-year-old Erin Walsh has been throwing up twice a night for the last 3 months, and her parents are at their wits' end. None of the doctors they've seen have been able to figure out what's going on with their little girl. And then, one night after Erin has fallen asleep, the unimaginable happens.
I'd ask her when she was done spitting up, "Erin, are you okay? Do you know what just happened?" And I remember watching her slur her words. And there would be drool coming out of the side of her mouth while she was talking to me. And I would just tear up. What's wrong with her now?
Kim is extremely alarmed by this new behavior and isn't sure what's going on with her only daughter.
But a minute after that, she would come to and she would talk to me normally again and say, "Mommy, I'm tired. Can I go back to sleep?" And I say, "Yes, it's okay." And I would just tuck her back in again. And I realized there's definitely something wrong with her that's not, stomach related. How does vomiting lead to slurring of your words? Could be something neurological.
Growing more anxious by the minute, Kim goes online and finds a neurologist covered by her insurance company.
I was hoping that, this person would at least point us in the right direction.
She then gathers Erin's medical records to hand over to Dr. Aviva Boyko at their first meeting.
When I first met Erin, I took a detailed history from the parents. Based on Erin's symptoms, they were repetitive, they were stereotypical, they were all the same.
Dr. Boyko immediately orders an MRI of Erin's brain. Kim and Raoul anxiously wait, hoping that finally they'll have the answers they've been hoping for. And the next day, the results come back normal. Next, Dr. Boyko orders an EEG, a non-invasive test used to detect brainwave activity. In Erin's case, 24 wires or leads are attached to her head to document her responses to different activities.
They had her sit in a chair and they made her do deep breathing exercises and they monitored her brain waves, and then they put a strobe light in front of her face and they would flash the light at different speeds to see if she was having any kind of hyper brain wave activity.
But even this sophisticated test shows that nothing abnormal is going on. Now there's only one thing left to do: try to recreate the situation that seems to be causing Erin to throw up. They need to perform an EEG at night while Erin is sleeping.
So the next step was to admit her for continuous EEG monitoring. And the target was to try and capture the nocturnal events of vomiting and to see what they were.
For the next 2 nights, Erin will be hooked up to an EEG, and Dr. Boyko's medical team will observe her while she's asleep.
She had 24, they call them leads, that were hooked up to her head, and they put a stocking cap over her head to hold the wires in place. And there was a video monitor in the room that videotaped her 24/7.
When I walked into the room and I saw Erin hooked up to all the wires, it was very scary. But you know that the purpose is to find out what's wrong. So inside you're thinking, please let somebody give us an answer here.
10 hours after being hooked up to the EEG, Erin begins to fall asleep while Kim stays close by in the room.
Erin went to bed around 9. and approximately 10 o'clock, she had an episode. And the nurse helped me clean her up. And about an hour and a half later, Erin had her second episode.
The next morning, Dr. Boyko reviews the EEG report and the video footage. Immediately, she notices a pattern in Erin's brainwave activity that is highly abnormal. And it's clear that this holds the answer to Erin's months of mysterious episodes.
Based on the history and subsequently on the prolonged continuous EEG monitoring, my suspicions were confirmed. The vomiting events were seizures. Erin had epilepsy.
Epilepsy is a neurological disorder characterized by more than one unprovoked seizure. These seizures occur when a person's brain signals temporarily go haywire, causing strange behavior, muscle twitching, and sometimes a loss of consciousness. They can originate in any part of the brain, and while the cause is often unknown, approximately 1.5 million Americans suffer from some form of epilepsy.
When Erin is having a seizure, there is excessive firing of neurons in her brain. She has alteration of awareness. That's why she's not remembering the event.
She described that when a person's having a seizure, the normal brain activity is not occurring. And so at night, for some reason, when Erin was in a deep sleep, her brain was telling her to throw up.
While Erin's family is elated to finally have a diagnosis, they can't help but wonder why Dr. Boyko was able to see what other doctors missed.
Epilepsy goes undiagnosed because people don't think about the subtle seizures to being epilepsy. However, pending the area of the brain that is being affected, seizures can be manifested as pins and needles in the hand, staring episodes, jerking, or abnormal sensation in the stomach can be seizures as well.
And the particular seizures Erin suffers from are actually extremely rare.
Erin is my only patient in my practice that has seizures being manifested as vomiting.
But despite their relief at finally getting an answer, the family is still extremely concerned about Erin's prognosis.
I didn't know how serious it was. What would her life be like now?
It's like 1,000 things running through my brain at one time. Visual pictures of her having a convulsion, possibly lying on the floor with tremors, and where is this going to go?
The good news is that while epilepsy cannot be cured, it can be managed with medication. But it takes trial and error to find the right combination and the right dose.
I take 14 pills. I used to take liquid, but then I learned how to swallow pills.
But while taking so much medication is not easy for anyone, especially a young child, there's no doubt that the epilepsy diagnosis may have saved Erin's life.
When you have continuous episodes of seizures without treatment, you're going to have memory problems, cognitive problems. Some seizures can cause brain damage, and some seizures can kill you.
And while the condition is serious, it may not be permanent. And Dr. Boyko is hopeful that one day Erin may outgrow these seizures.
As mysteriously as this came on, it could just go away. Time will have to tell whether or not she does grow out of it, but you know you're doing everything you can.
Today, 2 years after being diagnosed, Erin is in the 3rd grade and bravely managing her disorder.
Erin has been seizure-free for 3 months now. Every time I say that, I want to knock on wood to make sure that they don't come back. And we just take it on a day-by-day basis. But we're keeping our fingers crossed.
I just feel like I can deal with it. I just know sometimes it's going to happen and sometimes it's not.